Gastric aspirate is a very simple test, बहुत ही useful है, and it is most effective. Just put the mask, prevent the cross infection, put the gloves, and measure the length of the infant feeding tube. Measure the length of the nose to the ear lobe and then to the jiffy sternum. And see the marking is approximately 27 centimeters. Apply some lubrication. Apply some lubrication. Use either left nostril or right nostril the way you are comfortable. Since I am sitting on the side, I should have right nostril. It's very, very simple procedure. The key goes is if there's a resistance, you can redirect the tube. Give it some more lubrication. If there is difficulty in passing the tube, just raise the head slightly. Up to the mark for your identified. Just this. Remember to lovely and aspirate. This has to be done fasting 4 to 6 hours. If another material does not come, use the normal saline. Even his secretions can be sent for CBNAAT. You can just readjust the tube slightly. And this much estimate will be empty for seminar and culture. You can adjust the tube slightly. Air comes, you can remove the air. And you can do suctioning while withdrawing. And that's all. Put inside the container. Leave the mouth.